This has been a very interesting debate, Estimates Day debate on the building safety, and the cladding crisis, about which we have heard much in this debate, has made a mockery of the aspiration of a property-owning democracy, as families and young professionals find themselves literally trapped in unsafe buildings as they face life-changing bills to remove cladding in which they had no say in installing. I know the Minister will be keen to point out the £5.1 billion his department has announced to remediate this issue, but it's becoming clear with every speaker and with every day that passes that this will fall woefully short of what is required to fully address this issue. And at this juncture, I want to congratulate the Sunday Times for its excellent campaigning on this issue, showing the human cost to this crisis. Because this crisis is not about cladding, it's about people, and it's about families whose lives have been put on hold, whose plans to start or add to their families have been put on hold indefinitely, people facing eviction notices, people whose mental health has been adversely affected, people who feel suicidal because they look to the future and they cannot see a way out of this crisis, which is not of their own making. New figures from the Association of Residential Managing Agents and the Institute of Residential Property Management has published new data which looked at more than 750 buildings, concluding that leaseholders must still pay impossible sums of £20,000 each to fix smaller blocks and more than £14,000 for unfunded fire risks in tall buildings. Whilst a fifth of those affected were contemplating bankruptcy, 23% had taken out loans. Now, what's clear is that not enough due diligence has been done by this government into the true costs of remediation, which seems to have reckoned the costs on the basis of guesswork. However, the real costs are now being revealed to those affected. The financial costs are life-changing. The human cost is incalculable. The government has said that its £5.1 billion fund only covers buildings taller than 18 metres or 6 storeys with a 30-centimetre tolerance because it wanted to prioritise unsafe cladding that was a greater risk in taller blocks. However, the Sunday Times reports that a key civil servant was recorded telling fire engineers that 18 metres was the cut-off point because the government, and I quote, haven't got time to come up with a better number. Now we are seeing the reality of those who live in blocks who do not reach this 18-metre threshold, facing bills for stripping flammable cladding from their flats, which costs more than the flats themselves. Now, as for those in circumstances applying for a state loan about which we've heard much this afternoon to help cover costs, leaked letters from the Department of Housing and Local Government and the Treasury show that under the plans, loans will be low interest. They will not be interest-free. And at an annual rate of 1%, the interest alone on a £100,000 loan would cost £80 per month, meaning the loan would never be repaid, but would grow over time, making these flats even harder to sell. In any case, it seems these state loans, which are announced in February, won't be launched for at least another 2 years. In addition, there's the complication of flammable insulation and flammable balconies and faulty cavity barriers. There is no funding for these building dangers, despite the fact that properties cannot be sold or even insured for a reasonable cost until this remediation work is carried out. And I would wonder why I wonder if the Minister would like to explain why these particular areas were not included in the funding. What is clear is that more urgent and direct government intervention is needed. The Barnett consequentials in Scotland of £97.1 million to address the cladding issue is woefully inadequate, just as the sums allocated in England are inadequate as well. The remediation of cladding must not be left to householders and leaseholders with eye-watering bills they cannot afford to remove materials for which they have no responsibility. Following the publication of the recommendations from the Ministerial Working Group on Mortgage Lending and Cladding, property owners in Scotland living in buildings where safety concerns had been determined submitted an expression of interest in participating in the first phase of the single building assessment. Over 300 expressions of interest were submitted, and the selection of the buildings to be included in the first phase has been completed, and building owners are currently being notified. The single building assessment will provide clear evidence of the total need for remediation. All flatted properties will be covered, that is 770 high-rise buildings and many more at lower heights. This approach allows the Scottish Government to identify buildings which are at risk. If no risk is identified, this will release people from safety and mortgage lending concerns and may also save homeowners the hundreds of pounds they may otherwise have faced through paying for an individual external wall fire review form. The cost of single building assessments will be met by the Scottish Government, and once the single building assessment has been established, remediation can be targeted at the buildings most at risk. But it's also important, Madam Deputy Speaker, to have a holistic approach, and it's important to learn the lessons of the past through the use of sprinklers, interconnected fire alarms, which are also important for managing risks and potential fire outbreaks. This process must ensure that support is delivered fairly and remediation is delivered on a level playing field, so the risk of people being left out, as we know has happened in England under the first support scheme, won't happen in Scotland. In addition, there are ongoing concerns about extortionate building insurance costs, about which the Secretary of State is aware, and he said on the 10th of February that, and I quote, "As with the lenders, the insurers are faced with assessing a new and heightened level of risk. Nonetheless, the Association of British Insurers now needs to step up and take a proportionate risk-based approach. Insurers should be pricing that risk correctly and not passing on those costs or even profiteering." So what I would ask the Minister today is if he can update the House on this, because anecdotally we've all heard about householders receiving letters telling them that their insurance is to be terminated or for their insurance costs to be raised so dramatically that it becomes unaffordable overnight. Now, the Secretary of State said in February that the Government was prepared to step in as a last resort if engagement with the insurance industry did not improve matters. Is this still the case? And if so, how bad do matters have to become before Government steps in? We need more funding, and this can't be said too often, Madam Deputy Speaker, because the sums set aside are simply not adequate to the task at hand. The Housing, Communities and Local Government Committee indicated as much in its report published in April, putting the full cost of fire safety remediation at somewhere up to £15 billion, and called for the establishment of a comprehensive building safety fund to cover the cost of all remediation works on buildings of any height, which would be fully funded by Government and the industry. And as the Honourable Member for Leith and Edinburgh North pointed out, it is really important that the industry takes its responsibility seriously on this issue. Sounds eminently sensible, and I hope the Government response to that Housing, Communities and Local Government Committee report is positive, and I know it's due to be published soon. I say to the Minister, this issue is one of the great scandals of our generation. How much misery do those affected have to go through before there's a fair and comprehensive solution to this crisis? And when will sufficient funding be made available so that all who have been conned by poor cladding, flammable insulation and faulty cavity barriers can access the level of support they need so that they can just get on with their lives?